lecture number 3, that is on sterilization recommendation for laparoscopic surgeons. In this lecture, we are going to understand various types of sterilization and disinfection methodology, and let me give you some practical guidelines for day-to-day management in your OT. Next slide. If you see this picture, when we do laparoscopic surgery, we do use variety of equipments, expensive telescopes and camera, delicate hand instruments, especially the instruments with the long narrow lumens, hinges, tubes and wires. So we can't put them all together in an autoclave. Some are delicate, some may not be suitable for autoclaving. So one has to have some definite plan to sterilize each and every equipment during laparoscopic surgery. Next slide. The laparoscopic equipments are considered as critical equipments as far as the Spaulding's classification is concerned. What is Spaulding's classification? Let me explain it in the next slide. The Spaulding classifies all the medical devices based on the risk of infection into 3 types, namely the critical equipments, semi-critical equipments and non-critical devices. Critical equipments are those which enter normally sterile body tissue. Say for example, entering the peritoneal cavity or a joint cavity or a pleural cavity. So all the such surgical instruments, they need actually sterilization. Whereas semi-critical devices are those which enter an area which is covered by mucous membrane. A classical example is gastrointestinal system or respiratory system, like a bronchoscopy or a gastroscopy. So sterilization, even though it is preferable, if it is not feasible, we can even go for a high level disinfection, because you always have a mucosal membrane as a barrier to prevent infection getting in. When it comes to the non-critical devices, these devices are used where there is a intact skin between the device and the patient's body. Say for example, when we use ECG electrodes or using a stethoscope. So those need cleaning or a low level disinfection. But laparoscopic equipments, all of them are critical equipments. They need ideally sterilization or at least high level disinfection. So this is the guideline for prevention of surgical site infection 1999. Next slide. Understand the sterilization and disinfection. Sterilization is elimination of all living organisms including spores. Whereas high level disinfection, all the living organisms are eradicated, but not necessarily all the spores. The spores very often are spared in high level disinfections, so there is always a small chance these spores can germinate, cause some damage in some people. Next slide. Let us see carefully this slide. After surgery, the instruments, the blood-stained instruments have to be taken, disassembled and immediately soaked. Soaking is the stage 1 of sterilization cycle. Then they go for washing. After washing, we should go for some method of sterilization. Then after the sterilization, either we can store them or transport for next use or even for the next surgery. So this is what we call a sterilization cycle. Let us concentrate on every aspect in detail. Next slide. Coming to the soakage and washing. All the equipments, once they are used in any laparoscopic surgery, should be dismantled and soak them early and wash them well. That is a very important recommendation, because even if you leave 5 or 6 minutes after surgery, all the blood very difficult to remove. So as soon as the surgery is over, we need to put them in a warm water with some soap solution like a Savlon. Then you take it to the washing area. Use a good quality water and a detergent, preferably with some enzyme preparation, to wash, because washing takes away close to 90 to 95% of the bioburden. We should not rely only on sterilization to the job of eradicating the sperms. Most of all these germs can be eradicated by just simply washing them well. Next slide. Coming to the washing in particular, as we already know, all the hand instruments in particular, they are all in modular units. We need to disassemble them and take them for either manual or mechanical or ultrasonic cleaning. Once it's cleaned properly, we need to rinse them, dry them well, and check for any damage, then lubricate the working ends, then assemble them again, and then they may be ready for sterilization, or we can assemble them after the sterilization. Next slide. Particular when we are going to wash or clean the equipment, the two important things we should realize is the importance of flushing and brushing. We should have a running water, preferably soft water, and we should have a very like a pressure pump or pressure device where we can force the water through the long narrow lumens. And also we should brush areas which are notorious to hide the living organisms, namely the junctions between the insulating sheaths and activating mechanisms of laparoscopic instruments, and also the articulations and the grooves of the forceps, and also the long narrow lumens of the sheath. So all these areas can be carefully cleaned only if you have various types of brushes. So there are special tooth brushes, long brushes, and wide brushes or soft brushes are available for doing this purpose. And we need to teach our staffs to use all these equipments so that they should not damage the equipment, at the same time do the job of cleaning very well to minimize the bioburden to the acceptable level. Next slide. Coming to the type of the cleaning, even though the manual cleaning is good, it is cumbersome, so one may prefer, especially in a high turnover corporate setup, may use a machine washing. There are two types of machine washer, a tunnel type or a batch type, an ultrasonic cleaning device which by cavitational effect can clean all, even the small dirts. So very fine equipments like the accessories of endoscopy are preferably cleaned by using ultrasonic cleaning device if it is available in your hospital. Coming to the sterilization methodology, the recommendation 2. Next slide. There are at least 5 different types of sterilization methodology that can be discussed here: steam sterilization, ethylene oxide sterilization, chemical disinfection, formaldehyde cabinets and their use in the current scenario, and what are the newer methods available like gas plasma sterilization. Next slide. Coming to the steam sterilization, autoclave is by far one of the commonest mode of sterilization for open equipments, but even for laparoscopy, especially all the mechanical instruments like most of the trocars, hand instruments, even telescopes, that can be easily and safely sterilized. You should always go and read the manufacturer's instructions, of course, but provided you have what we call a porous load vacuum autoclaves. They should not be like a flash autoclave where there will be some condensation of water inside. We need a special porous load vacuum autoclaves, especially for wrapped instruments and instruments where we have long narrow lumens. The temperature setting is like open surgery, like 121 degrees centigrade for 15 minutes or 134 degrees centigrade for a shorter duration like 5 minutes. Sterilization is the benchmark for achieving sterilization of all the laparoscopic instruments, and the effectiveness of other sterilization methodology will be compared only with autoclave. Next slide. Coming to the utility of the ethylene oxide sterilization, it is useful especially when you have heat sensitive items like some of the hand instruments, this carbon dioxide tubes, various wires, even telescopes. One, if they are very worried that autoclave may not be applicable, they can use ethylene oxide sterilization, wherein lower temperature like 54 degrees centigrade for 150 minutes or 37 degrees centigrade for 5 hours are used. But after the use, ideally they should be kept in the aeration cabinet for nearly a day. And there are various ways to monitor the effectiveness of ethylene oxide sterilization by using indicator strips. But one should realize that there are some risks for the staffs, namely the contact injury or contact dermatitis, inhalation injuries because of ETO, and also it is expensive. But in a medium-sized hospital, it may be quite a good addition in addition to the autoclave. Next slide. One of the commonest method of sterilizing the laparoscopic equipment in most of the smaller hospitals, of course, is using germicides or a chemical disinfection. This is not actually sterilization, it is a high level disinfection. We could use either 2.4% glutaraldehyde or 3.4% glutaraldehyde or OPA, orthothallyl aldehyde, paracetic acid, hydrogen peroxide, superoxidized water. It usually goes through some stages, like we need to pre-wash and rinse them, then immerse them completely in the disinfectant solution for a set duration. Ideally should have a timer set, and 3.4% glutaraldehyde, usually the dwelling time is 20 minutes. But if you have the OPA, which is more recent version of glutaraldehyde, one may even have a sufficient or a satisfactory disinfection by dwelling for 12 minutes. The shelf life also varies, and usually 2 weeks to 4 weeks. We should always use the indicator strip, which shows the effectiveness of the disinfectant, and we should rinse the equipments once it's taken from the disinfectant with a sterile autoclaved water or distilled water. And we should understand the health hazards to the staffs, as in case of ethylene oxide. Next slide. And a lot of concerns raised, especially when we use chemical disinfection, especially when our rinsing protocol is not good, and if the water is contaminated in the hospital, it can cause infection by Mycobacterium chelonae. So the patients usually present with the discharging sinus wounds and port side sepsis, usually around 3 to 4 weeks after laparoscopy. So in that such situations, one has to take the discharge for acid fast bacilli and also do culture and biopsy. If it proved to be a case of Mycobacterium chelonae, one has to find the cause or the source of the contaminated tap water or a disinfectant and avoid such things happening. And we need to treat patients afflicted by this infection with either clarithromycin, ciprofloxacin, amikacin for 4 weeks. Next slide. We did a national survey on sterilization methods in India way back in 2005. I think it is mostly right even this year 2016, that is still close to 50% of the people in our country rely on formalin chamber, either wholly or partly, to sterilize their laparoscopic instruments. And the commonest method of sterilization is by chemical disinfection, that is using 2% Sidex. They seldom use autoclaving or ethylene oxide for laparoscopic equipments. We usually discourage people using formalin chamber. We have done a study where we found the formalin chamber is effective, if at all, only if we use a tight fitting formalin chamber, and we keep the instruments after doing a proper washing and drying, and the instruments should be kept in a disassembled condition, and we should keep at least 45 grams of formalin tablets, that is 45 tablets. There are 15 tablets in each tray, so if we have 3 trays in the chamber, and we should keep the instruments for minimum 5 to 8 hours, ideally overnight, in order to get some decent disinfection. And the chamber should be ideally kept outside the air conditioned theatre, because it needs a temperature at least 25 to 28 degrees centigrade and higher. If it is in the air conditioned environment, then formalin vapor release is minimized, so it may not be very effective. But having said this, we don't recommend formalin chamber in the era of recent advances in the sterilization methodology, especially we start operating on people with a hernia, and in these situations formalin chamber is usually not advised. Next slide. There are newer methods of sterilization: gas plasma sterilization and sterile system. The gas plasma sterilization uses hydrogen peroxide. It takes only 30 minutes at 50 degrees centigrade, and wherein we can put all heat sensitive items. But only disadvantage is it needs special packing and it can only accept small trays. But it is quite useful asset for any very busy laparoscopic unit. The other system, of course, is a sterile system, wherein parasitic acid is used for 30 minutes at 50 degrees centigrade, and only disadvantage being is a point of use system. We have to take it and use it the same day, within few hours. Next slide. Gas plasma sterilization uses vaporized hydrogen peroxide. It has 4 phases of sterilization, namely vacuum phase, injection phase, diffusion phase, and a plasma phase. Plasma is nothing but a collection of electrons, positive ions and neutrals. It is otherwise called fourth state of matter, and it is very bactericidal. And advantage of its being, it is not only safe, it doesn't release any undue or unnecessary toxic residuals. It is quite fast. Average time is around 30 to 40 minutes. No aeration is required, unlike in ethylene oxide, and useful for all heat sensitive items. The only disadvantage is it has a small chamber, it needs a special packing, and we should be very careful when we use instruments with long narrow lumens. Next slide. Disposable laparoscopic devices can be re-sterilized? Is a $1,000,000 question. The same question has been asked, even relevant to the endoscopic devices or accessories. But we need to realize the regulatory, ethical, medical, legal, economic issues in this one. Yes, of course, if we re-sterilize the disposable equipments, it makes economic sense. But if patient gets into trouble, and who is to blame? Is the instrument designer or instrument maker, or who did the sterilization of disposable equipment? The legal problem is there. And also, when we re-sterilize this equipment, always there is a question about its efficiency. The sharpness may go, the valves may not be working, and it may not be possible to properly clean a disposable laparoscopy devices as well as as good as reusable or a routine laparoscopic equipments. So because of all this concern, I think the recommendation is try not to reuse disposable laparoscopic devices. Next slide. So ladies and gentlemen, the good practice guidelines are as follows. If we have 3 or 4 cases lined up, say for example an appendix, gallbladder, hernia, you do the hernia first. So always a clean operation should precede clean contaminated or contaminated cases in the operating list. And also in a same patient, if the patient is having appendicectomy, cholecystectomy done, found to have hernia, never use a tap in that situation. Prophylactic antibiotics are necessary to minimize the wound infection, especially when we put some mesh in patients with the hernia. And when we take the mesh inside the patient, it should be through the trocar, not through the wound. And also we should have strict sterilization protocol. So ladies and gentlemen, we should have some practical guidelines, namely we should soak all the laparoscopic equipment early and wash them well. Cleaning is critical. We should choose the appropriate sterilization methodology, choose the one that suits you, and we should monitor the sterilization process to ensure reliability and safety, and we should maintain always a wound infection register so that we should always look out for any trouble. Thank you.